Hello guys, welcome back to my channel. If it is your first time here, you're welcome. If you've been here for quite some time, thank you for coming back again. So you guys, as you have seen the title of the video, today I am spilling the beans about my profession. Am I a doctor? Am I a nurse? Am I a radiographer? Am I a medical laboratory scientist? Am I a medical technologist? Am I a lab technician? Yeah, these are the questions that have been asked by so many people for such a long time because nobody knows what I do in Saudi except for the people that I work with. Of course, even the people that I work with, some of them, they still think that I am a nurse in the hospital, and some think that I am a doctor in the hospital because everybody here is a nurse and everybody is a doctor. So you just get to be in between. Nobody ever gets it right because people never think that sometimes there is a profession like this. Yes, there is. I am a medical laboratory technologist, which is known in some countries as a medical lab scientist. In other countries is known as laboratory technician. In other countries is known as lab scientist. Whichever way, I'm working in the laboratory and I am actually the one who tells the doctor what's wrong with the patient. Yeah, so you just need to give respects to the medical laboratory scientists because without them, the doctor will just be doing the guesswork, I guess. So they need us to confirm the diagnosis. Okay, I guess that summarizes everything that you need to know about this profession. As I said, I am in Saudi Arabia. I am a South African. I graduated in South Africa as a medical laboratory technologist, but because of some reasons I left the country, I am now in Saudi Arabia doing the same job. Okay, so to be a medical technologist or scientist, you have to have studied some science courses in school and in university as well. And depending on where you are, the course takes about 4 years and 5 years in other countries. And yeah, once you graduate, then you are qualified to be a medical technologist. I think in any country, once you graduate from university, before you can start practicing, you will have to do the board exam for that particular country, and then you get a license, then you can work. Okay, now licenses that we get from our countries are not the same licenses that we can use to practice in other countries. So in each and every country that you go to, you will have to follow the same procedure and register with their medical technologist or scientist board, and then you can get a license to practice in that country, which is what I did when I came to Saudi. I had to be registered with Saudi Council as a medical technologist. Now, this one depends on the country that you're going to, because in some countries, they will kind of maybe undermine your education coming from the country where you come from, and they will require you to sit for an exam in order for you to be able to practice. But in other countries, they will check your education and they will verify it and see if it matches with their standards. If that's the case, then they will give you the license to practice in their country. So yeah, what does a technologist or scientist do in the lab? So for those who don't understand, if you go to a doctor or you go to the hospital and they extract some bloods from you, they will then send those bloods to the laboratory. So the person who is going to be analyzing these bloods or whichever specimen that is taken from you, be it sputum, be it a stool, it will be analyzed by a medical laboratory technologist or technician or scientist in the lab, and they will give the results to the doctor, and then doctor will finalize the diagnosis. Right. So, being a lab technologist, it is not really a nice job because we have to deal with different specimens, as mentioned. We deal with your stools. Yes, we have to analyze your stool in the lab. We have to analyze your sputums. Yes, we have to analyze your urine. You have to analyze your blood. We have to analyze your body parts, your tissues, your, you name it, everything that is being taken from the person and being sent to the laboratory. It is our job to make analysis and give the report to the doctor. Okay, so give some respect to the medical technologist.